I come in?
Yes.
So I'm Emily, I'm the student nurse, and I'm going to be doing a ears, nose, and throat physical examination on you today. Will that be all right with you?
Yes.
And is that all right that I have you recording for this?
Yes.
Can I please have your name and date of birth?
Robert Jenkins, June 23rd, 1982.
Okay, perfect, thank you. So the first thing I'm going to do is ask you some questions. Are you having any hearing issues?
No.
Any loss of taste or smell?
No.
Any issues with swallowing?
No.
Okay, I'm gonna go ahead and inspect the exterior ears. I'm looking at the skin for color and any lesions. Check both sides here. Okay. So ears are symmetric. Skin color matches ethnicity without any lesions bilaterally. So now I'm gonna go ahead and palpate the external ears. So I'm going to palpate the auricle, pinna, and tragus for tenderness, and just let me know if you feel any tenderness upon palpation, okay? So just pull here, any pain?
No.
Okay, palpate the other ear. Any pain or tenderness?
No.
Okay, so no tenderness upon palpation. Now I'm going to go ahead and perform a hearing exam. I'm going to assess the cranial nerve number 12, which is the acoustic with the whisper test. I'm just going to have you place your hand over your right ear. Perfect. And I'm going to whisper a 2-syllable word, and I'm going to have you just repeat it after me, okay?
Mm-hmm. Regis.
Yeah. Now I'm going to have you cover your other ear.
Football.
Okay, awesome. So now I'm going to go ahead and perform the Weber test with the tuning fork. So I'm just going to hit the fork once over my hand, and I'm just going to place it on the top of your head, and you're going to let me know if you hear anything on both ears, okay?
Yes.
Okay, perfect. And now I'm going to go ahead and perform the Rennie test with the tuning fork. So again, I'm just going to hit it with the palm of my hand. I'm going to place it back here. You're going to let me know when you don't hear it anymore, okay?
I don't hear it.
Okay. How about now?
I don't hear it.
Okay. We do the same thing on the other side. You don't hear it?
I don't hear it. I don't hear it.
Okay. So air conduction is longer than bone conduction. Ratio is 2:1. Hearing tone equal bilaterally, and cranial nerve number 8 is intact. Cranial nerve intact. So now I'm going to go ahead and examine the external ear canal. So using my otoscope here, I am going to just, and I'm going to put a plastic speculum cover over my otoscope to protect you. And I'm going to observe, I'm going to insert correctly and carefully, assessing the healthy ear first. I'm just assessing, looking at, you know, what's going on and looking a little bit inside the ear. Okay, go to the other side. Okay. All right, so external ear canal with cilia present, so positive cilia, minimal cerumen observed. And now I'm going to examine the internal ear structures. So I'm going to be checking, identifying the tympanic membrane, cone of light position, and the malleus. So again, I'm going to look a little bit deeper this time. Tympanic membrane, pearly gray, cone of light, a 5 o'clock noted. Let me check the other ear, make sure it's the same. We want symmetry. So tympanic membrane pearly gray, cone of light 5 o'clock, and that is symmetric on both ears. And now I'm going to go ahead and inspect your nose. So I'm going to inspect your nose, your nares for symmetry. So have you look this way at me, okay? And I'm going to have you look up for me. I'm just checking for any erythema, any drainage, or any lesions seen. Okay. So nose is midline, and both nares symmetric, no lesions or drainage noted. Now I'm going to go ahead and palpate your nose. I'm just going to just let me know if you feel any tenderness upon palpation, okay? Be very careful using one finger. Any pain or pain?
No.
Okay. Okay. So denies tenderness or no masses. So now I'm going to go ahead and assess your olfactory, cranial nerve 1 olfactory nerve. So I'm going to have you hold one nair down, and you're just going to breathe out. Okay. I'm going to have you cover your other nair. Breathe out for me. Okay. So nares patent bilaterally, and cranial nerve 1 is intact. So now I'm going to go ahead and inspect the structures of the mouth and the throat. So I'm going to inspect your lips for lesions and fissures. So I'm just going to, it's not very bright in here. I'm just going to, okay, perfect. So lips are pink and moist. Inspect teeth for dental decay. So I'm going to have you just smile for me. Okay. I'm going to have you just hold your lips up for me so I can see the top of your gums, the gingiva. Okay. Now pull your fingers down so I can see the bottom. Okay. So lips dry but intact, no foul odor, gingiva pink, red, all teeth are intact. I'm going to go ahead and check the buccal mucosa. So I'm going to have you open your mouth again for me, please. I'm just going to look at the buccal mucosa, which is pink and moist bilaterally. And now the parotid glands, visualizing upper cheeks, lateral two molars, and the cranial nerve, the glossopharyngeal for symmetric rise of soft palate, and the hypoglossal for midline tongue. So stick your tongue straight out for me and move it left to right, left to right. Okay, perfect. So glossopharyngeal cranial nerve intact, and hypoglossal cranial nerve also intact. Frenulum intact on floor of mouth without lesions. I'm just going to have you lift your tongue up for me. Tongue up. Okay, let me see your palate. All right, so palate is pink and moist. Let me see tongue way out. I'm just going to see the back of your tongue. Let's see your tonsils. Tongue way out. Say Okay. Okay. So frenulum intact in floor of mouth without lesions. Color pink, vascular, moist. Pharynx without lesions. Tonsils between pillars. +2 bilaterally. And that is the end of our assessment.